Hermann Feldmayer, the professor of tropical medicine from the Humboldt University, who will be giving us a little bit of insight into the jigger menace here in Kenya and around the world. He has been in the country since Saturday and trying to make sure that research is going to be able to be conducted around sometime next year. So thank you so much for coming into the studios, Professor Feldmayer. Let's start with quickly on the origin of jiggers and whether jiggers does exist outside of Kenya and outside of Africa.
In fact, jiggers is a kind of imported disease to Africa.
Yeah.
So originally the parasite existed only in South America, and it was introduced, I think, about 1875. By 1875 by a sailing boat which came from Brazil and embarked in Angola, and probably some of the sailors were infected with jiggers, and when they put their feet ashore they imported the parasite to the African continent. So within 25 years the jigger parasite, the jigger flea, spread all over sub-Saharan Africa, and already in 1900 the disease occurred in Madagascar. So since then, the disease is here.
Okay, so since the 1800s, the disease has been in Africa?
Yeah.
Okay, great.
And predominantly, it spread in rural areas.
Yeah. Okay, and the issue of stigma that we see in Kenya to do with jiggers, does the same stigma exist in Brazil where it originated from?
Yeah, because jiggers has some characteristics which are the same all over the world, in all countries where jiggers is a health problem.
Poor areas, rural areas.
Yeah, you could say it's correct to say that jiggers affects the poorest of the poor. So when you have jiggers, that indicates to your neighbors, that indicates to a nurse or to a doctor that you are very poor. And I think this is the origin of the stigma associated with the jiggers. Besides, jiggers mutilates your feet. It cripples you. And you look at the feet of those children, this looks really ugly. So you feel ashamed and embarrassed because your feet look so ugly.
And children at school, they tease you.
Yeah, and other children tease you, and you have jiggers, I don't have jiggers. Those who have jiggers cannot play football. So they are excluded by the society, for example.
Okay, and you've been conducting research on jiggers in Germany as well and in Brazil. Have you found any medication that can help jiggers other than what we use currently in Kenya?
Yeah, this is a very important question. So we know this disease since hundreds of years, and it's surprising to see that there is no medication of which we could say it's reliable. So we have tested some medications in studies in Brazil. We used drugs which were available for other tropical diseases. But there is no convincing evidence that these drugs are really very effective. So what we are looking for now is a new type of medication, which at the same time is effective and at the same time will not cost so much money. But this is not an easy task to undertake. So many people are affected, but nobody cared ever how should we treat those people. So in the health sector, if you ask your doctor, even a professor at the university, please make me a prescription for jiggers, he will say, I apologize, I don't know what to prescribe. So this is the status, and that shows we are still at the really basis to develop a good medication for jiggers.
Because most governments are not, they're not dedicated to finding a cure for jiggers?
This is understandable. I think Kenya, Madagascar, Ghana, these are the countries which I know very well. The problem is the same. People who have jiggers, who are affected, don't consult a health center. So in the health center, there is no report on the occurrence of jiggers in the population. Patients don't go to the hospital, so there is no report in a hospital that patients with jiggers were there. And then, of course, the Ministry of Health does not receive any information from the countryside, and then the minister has to conclude, oh, this disease I have never heard about, does it exist? So it's because those people who are affected have no access to healthcare or decide not to consult healthcare. That explains why on the government level the information is rather scarce on the disease.
Of course. And you've been working with the Hardy Kenya Trust and with the Ministry of Health here.
Exactly.
You want to conduct some research sometime next year.
Yeah.
What will this research achieve for
the idea of the research is to compare the standard treatment which is used in Kenya, which is potassium permanganate, to compare it to a new medication which we have brought from Germany. So this would be done in a kind of proof of principle study, just to show that this new medication is working. And once we have shown that, we have proved that, we can go to a second step and enlarge the number of patients to be treated. And then I think after a period of 6 months, we would be sure to say there is a new medication, it's proved, it can be approved, and then it can be distributed not only in Kenya, but in all the other countries which are affected.
Okay. Thank you so much, Dr. Feldmayer, and I wish you all the best in your research next year. Thank you so much, and thank you for all the work that you're doing to curb the Jigger menace. Thank you so much for coming in studio. That has been Professor Hermann Feldmayer from the Humboldt University. He's the professor of tropical medicine there, and let's hope that the Jigger menace, they will find a cure for it, or maybe